So this patient that has knee osteoarthritis, we want to use electrical stimulation for pain control because he reports having pain up to 8 out of 10 when standing or walking, and after physical therapy he had a still pain of 5 out of 10. Those are activities of daily living and therapeutic activities that are part of his plan of care. And so 10s can be used to attenuate the pain that limits activities such as those. And so he is a good candidate for using electrical stimulation to decrease pain. The contraindications for electrical stimulation are over or close to a pacemaker or another active implant. If the patient is pregnant, we don't want to place electrical stimulation locally over the area such as the pelvis or the hips or abdomen or lower back. We don't want to place it over the carotid sinus. That'll cause a drop in heart rate or blood pressure. We don't want to place it over skin with a lack of sensation. It might cause a burn or something else that the patient wouldn't be able to feel if it was occurring. If they have impaired cognition, we don't want to use it. If they have a hemorrhage over the area, we don't want to use it. If they have thrombosis or thrombophlebitis, if they have a local malignant tumor, we don't want to place it on the eyes internally or on reproductive organs, and we don't want to place it over damaged skin. So for this video, I'm going to be using high rate 10s, or also known as conventional, and it is a biphasic pulsed current, and the pulse duration can range anywhere from 50 to 100 microseconds, so I'll be setting it to 100 microseconds. The pulse frequency can range from 80 to 110 hertz, so I'll be setting it to 100. The current amplitude depends on the patient, so with the high rate 10s, we want to be able to feel a little bit of a tingle or a buzz, almost like TV static for them. The treatment time, it can be anywhere from 20 minutes on, so for this patient I'll be doing it for 30 minutes, just to kind of keep it short the first treatment so that the patient can get used to it, but since it is more of a comfortable instead of noxious, then we can leave it on for longer. And this type of 10s, the conventional 10s, is used to stimulate A beta sensory fibers, and that stimulation acts as a gate control to block the nociceptive fibers. Okay, Kayla, so now that we've worn you out a little bit from therapy, I know that knee is pretty sore and everything. We're going to try what's called electrical stimulation. So we're going to be placing these pads on your knee, and they're just going to go right here and right here, and it'll help to kind of alleviate some of that pain that you're experiencing from your osteoarthritis in that knee. So I think that it'll be really beneficial, but before we do anything, I'm just going to go through a list of contraindications. It's totally safe, but we just want to make sure you don't have any of these symptoms or anything. You don't have a pacemaker or active implant anywhere near your knee. Are you pregnant? Okay. We're not putting this over the neck or anything, so carotid sinus isn't a big deal. You have normal sensation here in your knee. You can feel when I touch your knee. Yeah. And have you ever been diagnosed with impaired cognition? Mm-hmm. Okay. You have no hemorrhaging or anything in the area, so we should be good there. Do you have thrombosis or thrombophlebitis? Okay. Ever been diagnosed with any malignant tumors around or near your knee? Nope. Okay, and then the skin is intact, and so it's not over any damaged skin or anything, so we should be good. Are you okay with me placing these on you in electrical stimulation? Yes. And everything? Mm-hmm. Okay, perfect. If it does ever at any point feel uncomfortable or anything, let me know and we can remove these pads. Okay, so skin looks good and everything, so I'm just going to place these right there and on the medial side of your knee. Okay, and now we will set up the machine. So for time, we're going to increase that to 30 minutes. And for the rate, we're going to increase that to 100. And then for the width, we're going to decrease that to 100. Okay, and then as far as intensity goes, we're just going to turn it up until our patient here feels a little tingling or buzzing in that knee area. Okay, Kayla, so just let me know when you feel a tingling or buzzing. It almost feels like TV static kind of in that knee, okay? Feeling anything like that yet?
Just a little bit.
Okay. Right there?
Yeah.
Okay, go ahead and lay down. We'll get this pillow up underneath your legs here. Are you comfortable like that?
Yes.
Okay, perfect. So we'll leave that on for 30 minutes and then we'll call it good.
Okay, perfect.
So we have our patient positioned here. She is comfortable and we're leaving that on for 30 seconds. And we have the we have it set to continuous. We don't have any ramp up or ramp down time, and we have it set to biphasic and normal. So that's been on for 30 seconds now. For the sake of the video, we'll go ahead and stop this now. Okay, so I'm gonna go ahead and remove these pads. Okay, and any discomfort or anything in this area? Nope. Here? Okay, and skin looks good, no burns or anything are visible. So thank you so much.